In today's video, we are going to be talking about 5 warning signs that your kidneys are failing. Stay tuned for the last sign because it can lead to dialysis if you don't know how to stop it. As many of you already know, I am a wife, a mother of 2 boys, and a kidney patient. Both of my kidneys have been removed, and I have been on dialysis for over 17 years. I started making this video series to share what life is like with kidney disease, what you can do to help prevent kidney disease from getting worse, and also to share some success stories of people that have been able to reverse kidney damage or even avoid dialysis by making simple changes. I'd like to thank each and every one of you who take the time to comment and send messages. I try my very best to reply to as many of them as possible, but sometimes it takes me a little bit of time. If you are new here, please go ahead and subscribe. And if you enjoy my videos, please hit that like button. All right, let's get started. The first warning sign that your kidneys may be failing is having more than 4 colds in 1 year. You might say, what does being cold have to do with your kidneys? Well, let me explain. When you get a cold, your body produces extra antibodies to fight off the virus that is attacking you. Some of these antibodies are called immunoglobulins. Immunoglobulins are proteins that are made by plasma cells. They are part of the immune system, and their job is to identify and neutralize pathogens like viruses, bacteria, and toxins. And when you have a lot of immunoglobulins in your blood, it can cause a condition called hyperglobulinemia. Hyper meaning high, and globulinemia meaning presence of too much protein in the blood. This can make it harder for your blood to flow through your kidneys, which can cause proteinuria. Proteinuria is when there is too much protein in your urine. When this happens, your body starts to excrete these immunoglobulins through your urine. As you can see, the antibodies are huge compared to the size of the kidney's filters. So instead of being filtered out, they start to clog up your kidneys. This can cause your kidneys to start to fail. Test to avoid dialysis. Make sure you don't get sick and always practice good hand hygiene. Always wash your hands before eating or preparing food. Avoid touching your face, especially your eyes, nose, and mouth. Stay away from people who are sick, and keep away from sick people at home. Get plenty of rest, manage stress, eat healthy foods, exercise regularly, and stay hydrated. These will all help boost your immune system so you don't get sick often. If you do get sick, make sure you treat the infection right away and finish all of your antibiotics so that the infection doesn't come back and cause further damage to your kidneys. The second warning sign that your kidneys are failing is persistent puffiness around your eyes and feet. When your kidneys are damaged, they are not able to filter waste and excess fluid out of your blood as efficiently as they should. This can cause fluid to build up in the tissues of your body. Fluid retention can cause swelling in many parts of the body, including around your eyes and feet. This is called edema. You can check for edema by pressing your finger into the skin of your lower leg, ankle, or foot. If the depression or the dimple remains after you remove your finger, you most likely have edema. Another way you can check for edema is by checking the amount of weight that you gain from day to day. Make sure you weigh yourself at the same time every morning, and be sure not to eat or drink anything first. If you gain 3 pounds or more in 1 day, this could be a sign that you are retaining fluid, and your kidneys are not filtering like they should. Test to avoid dialysis. Don't eat salty foods. Salt makes your body retain water. Cut back on caffeine. Caffeine is a diuretic, which means it will make you urinate more often, but it can also cause your body to retain more water. Alcohol is another diuretic. It causes you to lose water, and this can cause your body to become dehydrated and put a strain on your kidneys. To help your kidneys function better, stay away from processed foods. They are usually high in sodium and potassium, both of which can cause your body to hold on to more water. Also, avoid drinking too much water. It may sound strange, but drinking too much water can actually cause more water to be retained. The reason for this is your kidneys can only process about a liter of water per hour. So if you're drinking more than that, the excess water will be retained in your body. It is important that you talk to your doctor before making any major changes to your diet or fluid intake. Warning sign number 3 that your kidneys are failing is having a sudden loss of appetite. Kidneys produce a hormone called erythropoietin. Erythropoietin signals your bone marrow to make red blood cells. If your kidneys aren't working well, you may not have enough erythropoietin in your body. This can cause anemia, which can cause you to feel tired and weak all the time, and it can cause you to lose your appetite. Loss of appetite can also be caused by high levels of waste products in the blood. When your kidneys aren't working properly, waste products like urea can build up in your blood. These waste products can cause you to feel sick, which can cause you to lose your appetite. Also, when your kidneys aren't working properly, you may have high levels of a hormone called calcitriol. Calcitriol is the active form of vitamin D. High levels of this hormone can cause you to lose your appetite. Test to avoid dialysis. Eat smaller meals throughout the day. This will help stimulate your appetite. If you're not hungry in the morning, wait a little while and then eat something small. If you still aren't hungry, just drink a little something to make sure you're getting some calories. Make sure you are eating nutrient-dense foods, foods that are high in vitamins and minerals. Good examples of nutrient-dense foods are salmon, sweet potatoes, avocados, and spinach. Also, make sure you are taking your vitamins and supplements as prescribed by your doctor. You should be taking iron supplements if you have anemia, and vitamin D and calcium supplements if you have low levels of these. If you are finding this video helpful, please hit that like button and share it with others. Alright, let's move on to the next warning sign. Number 4 is easy bruising. When your kidneys are damaged, they can't make a certain protein called albumin. Albumin helps to keep fluid in your blood vessels. Without enough albumin in your blood, fluid can leak out of your blood vessels and into the tissues of your skin. This can make it easier for you to bruise yourself. You may bruise yourself easily if you are bumping into things or walking into walls or doors. Bruising can also be caused by a vitamin K deficiency. Vitamin K helps your blood clot when you are injured. So if you are low in vitamin K, you may bruise more easily. Certain medications can also affect the way your blood clots. If you are taking blood pressure medication or other medications that can thin your blood, you may bruise more easily. Test to avoid dialysis. Eat foods that are high in vitamin K. Good sources of vitamin K are kale, broccoli, collard greens, liver, and cauliflower. Be careful when you are cooking with vitamin K. Don't overcook it. Overcooking can destroy vitamin K. Also, be careful when you walk. Watch where you are going and use a cane or walker if you need to. And remember, the last warning sign that your kidneys are failing is extremely important. Please don't miss it. Number 5 is foamy or bubbly urine. When your kidneys are damaged, they can't filter waste and excess fluid out of your blood as efficiently as they should. This can cause a buildup of certain substances in your urine. One of these substances is protein. Protein in the urine can make it foamy or bubbly. Protein in the urine can be caused by many things, such as high blood pressure, diabetes, and glomerulonephritis. Also, when your kidneys are damaged, they can't concentrate your urine as efficiently as they should. This can cause your urine to be very dilute. Dilute urine can also cause your urine to be foamy or bubbly. Test to avoid dialysis. See your doctor immediately. Your doctor will do tests to determine the cause of the foamy or bubbly urine. Treatment will depend on the cause. If you have high blood pressure, your doctor will work to control your blood pressure. If you have diabetes, your doctor will work to control your blood sugar levels. If you have glomerulonephritis, your doctor may prescribe medications to reduce inflammation in your kidneys. I would like to remind you that I am not your doctor, and this video is not intended to replace medical advice, treatment, or diagnosis. If you have any concerns about your health, please talk to your doctor. Thank you so much for watching. I hope you have a wonderful day. Remember, knowledge is power. The more you know about your condition, the better you can manage it. Be strong and take care.